So for this particular drug, the side effects occur in 5% of the patients. And they include terrible things: debilitating muscle and joint pain, gastrointestinal distress. But now you're thinking, well, 5%, not very likely it's going to happen to me, I'll still take the drug. But wait a minute. Remember, under stress, we're not thinking clearly. So think about how you're going to work through this ahead of time so you don't have to manufacture the chain of reasoning on the spot. 300 people take the drug, right? One person's helped. 5% of those 300 have side effects. That's 15 people. You're 15 times more likely to be harmed by the drug than you are to be helped by the drug. I'm not saying whether you should take the statin or not. I'm just saying you should have this conversation with your doctor. Medical ethics requires it. It's part of the principle of informed consent. You have the right to have access to this kind of information to begin the conversation about whether you want to take the risks or not. Now, you might be thinking I've pulled this number out of the air for shock value. But in fact, it's rather typical, this number needed to treat. For the most widely performed surgery on men over the age of 50, removal of the prostate for cancer, the number needed to treat is 49. That's right, 49 surgeries are done for every one person who's helped. And the side effects in that case occur in 50% of the patients. The idea of the premortem is to think ahead of time to the questions that you might be able to ask that will push the conversation forward. You don't want to have to manufacture all of this on the spot. And you also want to think about things like quality of life, because you have a choice oftentimes. Do I want a shorter life that's pain-free, or a longer life that might have a great deal of pain towards the end? These are things to talk about and think about now with your family and your loved ones. You might change your mind in the heat of the moment, but at least you're practiced with this kind of thinking. Remember, our brain under stress releases cortisol. And one of the things that happens at that moment is a whole bunch of systems shut down. There's an evolutionary reason for this. Face to face with a predator, you don't need your digestive system or your libido or your immune system, because if your body is expending metabolism on those things and you don't react quickly, you might become the lion's lunch, and then none of those things matter. Unfortunately, one of the things that goes out the window during those times of stress is rational, logical thinking, as Danny Kahneman and his colleagues have shown. So we need to train ourselves to think ahead to these kinds of situations.